Clive Orville Callender, born 1936, died 2014, African-American surgeon. Clive Orville Callender has been at the forefront of promoting organ donor programs in the United States and abroad. As the transplant director at Howard University Hospital in Washington, D.C., and as professor of the hospital's Department of Surgery, Callender is a leading transplant surgeon and spokesperson for health issues pertaining to the African American community. Clive Orville Callender was born on November 16, 1936, to Joseph Callender and Ida Burke in New York City. He was inspired at an early age to become a missionary doctor after hearing a sermon in his church. Callender graduated from Hunter College in New York in 1959 with degrees in chemistry and physiology, and then attended Meharry Medical College in Nashville, Tennessee. In 1963, he graduated first in his class and won the Charles Nelson Gold Medal. He married Fern Irene Marshall in May of 1968, and they eventually had 3 children, Joseph, Elena, and Ariane. During his internship at the University of Cincinnati, Callender became interested in surgery and obtained further training in the specialty as chief resident at Howard University and Freedman's Hospital. He became an instructor at the university in 1969. The following year, he became a medical officer at D.C. General Hospital. Shortly thereafter, his invitation to work as a surgeon at Port Harcourt General Hospital in Nigeria during the Biafran Civil War fulfilled his dream of being a missionary doctor. Upon returning to the United States, Callender became interested in transplant surgery and was granted a 2-year National Institutes of Health Fellowship and a 1-year fellowship at the University of Minnesota to become a transplant specialist. Following this, he formed the Transplant Center at Howard University. 10 years later, in 1983, Callender established another transplant center in the Virgin Islands, which was named in his honor. Callender became concerned when he detected a resistance among African Americans toward donating organs. His inquiry into the issue uncovered that many felt that needy minorities were less likely to receive an organ transplant than white patients. Some objected to transplants because the procedure violated their religious beliefs about not disturbing the body after death. Others were afraid they would be declared dead prematurely if they had promised an organ. Callender has traveled throughout the United States, Europe, and the Caribbean on his mission to dispel these misconceptions about organ and tissue transplants. Together with organ donors, recipients, and those waiting for transplants, he has given workshops aimed at increasing the number of minority donors. In addition, he testified before the U.S. Senate in 1983 in a successful attempt to increase government funding for community education on the issue. Callender's efforts have begun to pay off. In a 1990 Gallup poll found that 24% of African Americans surveyed said they had signed organ donor cards, up from 7% in 1985. Callender sees organ transplant awareness as a crucial issue for African Americans because they represent 30% of all dialysis patients and because they often fare poorly after the procedure. To prevent a backlash, Callender told New York Times writer Paul Delaney that, quote, "Blacks themselves have to do more," unquote, and become more involved in healthcare issues. In 1989, Callender was elected to the Hunter College Alumni Hall of Fame. As of 1994, he was the only African-American member of the Task Force on Organ Procurement and Transplantation. Since 1979, he has also been the president of the National Capital Area Branch of the National Kidney Foundation. Citations and sources of this audio are in the description.